Good evening, everyone, and welcome back to webinar 18. For those of you who don't know me, my name is Bianca. I'm the Communications Director at Canadian Academy of Clinical Sleep Disorder Disciplines. Tonight, we are welcoming back Dr. Lettieri, who is presenting the physiologic effects of sleep debt. If you were unable to join us for Dr. Lettieri's previous webinar, which was in March, you can still watch his recorded video on the website, and you can simply log in and visit the webinars page. Before we get started, I'll just remind everyone to keep their microphones muted throughout the webinar. And also after Dr. Lettieri completes his presentation, we'll go into a question and answer period. Please feel free to send me your questions throughout the presentation. Just use the chat box at the bottom of your screen, and I will ask them anonymously. And then after that, we can open up the floor to any verbal questions you might have. Dr. Lettieri is a professor of medicine at the Uniformed Services University of the Health Sciences and currently serves as the Director of Respiratory Therapy for Johns Hopkins Suburban Hospital. He is board certified in internal medicine, pulmonary medicine, critical care medicine, and sleep medicine, and certified in clinical investigation and research regulatory oversight. Dr. Lettieri previously served as the Chief and Medical Director for Sleep Medicine at the Walter Reed National Military Medical Center, and he has and currently serves on numerous boards and task forces related to sleep medicine and dental sleep medicine. So welcome back, Dr. Lettieri, and thank you for joining us tonight.
Thank you very much for having me. I hope this lecture is enjoyable for you guys. David had asked me to do a talk on the physiologic effects of sleep debt, which I think is important not only for us to understand as health professionals, because a lot of our patients have this, but as individuals, many of us are probably incurring ongoing sleep debt. And so hopefully this talk is enlightening for you. So I don't have any, well, I clicked the wrong button, so I already messed up my first slide. I don't have any relevant conflicts of interest, although I am adamantly against the sleep debt over time. So the U.S. Preventive Task Force 7 years ago, and again 3 years ago, listed insufficient sleep as a public health concern, originally, and then a public health crisis. Not only is it common, it's leading to increased morbidity and mortality, and is now considered a high-risk condition for diabetes, stroke, and cardiovascular disease. So what we're going to talk about today is what is the role of sleep? What is the role of sleep? What normal sleep is? How much sleep do we need? And then we'll talk about how much sleep we actually get. And then we'll break down what are the physiologic effects, the adverse effects of chronic sleep debt, and those how it impacts our health, our cognitive performance, our physical performance, and then the effect it has on mortality. So what is sleep? Sleep is not the absence of wake. Really, to be awake, you have to both turn on wake and turn off sleep. And to be asleep, you have to turn on sleep and turn off wake. They're mutually exclusive phenomena. Sleep is actually very complex, and it's regulated, much like wake is very complex, and they're both regulated by both active and inhibitory neurochemicals. So again, just to simplify it, you have certain elements, certain chemicals and transmitters that to be asleep have to turn on sleep, and at the same time concomitantly have to turn off wake. Sometimes we can do one without the other. So if you can turn on wake without turning off sleep, if sleep intrudes into wake, well, that's things like narcolepsy. And if you're asleep but you can't block wake and wake is intruding into sleep, that's a lot of the hyper-aroused insomnias. Sleep is really mediated by two different processes. One is internal and one is really external. So the internal one is our circadian rhythm. It's our biologic clock that everybody is born with, something very unique. You can manipulate it over time. Not only does it say when we should be awake and when we should be asleep, but also really regulates a lot of homeostatic processes that keep our body going the way it's supposed to. And it can not only turn on and off wake at certain times, it changes our temperature throughout the day. We have alterations in different hormones and different neurotransmitters. And it really is those biologic clocks that help us regulate sleep and wake. So true a watch and knowing that it's breakfast, knowing it's time to go to work, when the news comes on, all those external factors do help us understand better and those external cues of what time it is. But internally, we actually have an amazing rhythm that really does turn on and off things at different times of the day. Everybody's a little bit different with their circadian rhythms. There are some people who are night owls and some who are morning larks. They want to go to bed early and get up early. Some people want to stay up late and sleep in. It does change throughout the course of our lives, where teenagers tend to be a lot more delayed, want to go to bed late and get up late, and older people are classically advanced, where they get up at early in the morning and go to bed early, have dinner, early bird specials. So, but everybody and, most adults are about an 10 to 6 or 11 to 7 sleeper, meaning your circadian rhythm is such that you're going to sleep from about 10 p.m. to 6 a.m. or 11 p.m. to 7 a.m. The other thing is our external sleep drive. Really, the simple thing is, the longer you're awake and the more calories you burn, the sleepier you get. That's largely mediated by a hormone called adenosine. And so the longer you're awake, the more adenosine you accumulate. The more calories you burn through exercise or other metabolic expenditure, the more adenosine you accumulate. And at some point, you have so much adenosine, it makes us sleepy. It's an external sleep drive. The antagonist of adenosine is caffeine. And that's why caffeine blocks that sedating effect of adenosine. It makes us feel more awake. So if you can align your circadian rhythm with when you're peaking adenosine, meaning I'm up all day, I have my peak adenosine at about the same time that my circadian rhythm says to go to sleep, then we usually have a pretty easy time going to bed. Adenosine is rapidly cleared with sleep. So if you've ever fallen asleep on the couch and then you go to bed and all of a sudden you can't fall asleep because you've gotten rid of enough of that adenosine level that was driving your sleepiness. So really, you want to try to always align your sleep-wake cycle with when your adenosine is peaking. It's one of the reasons why afternoon naps can lead to insomnia, right? You need to accumulate that adenosine, but also you don't want to push past your normal bedtime, because then you can actually become impaired because of that increased adenosine. Now, unfortunately, people can become tolerant of the sedating effects of adenosine. Like other things that you can become tolerant to, you upregulate receptors. You recognize the effects of the sedating effects of adenosine much less. We always would say, look, before I was a resident, I couldn't stay awake for 20 hours straight, and by the end of residency, I could stay awake for 3 days straight, just because you got so used to being sleep deprived. Well, that's true for anybody. The longer the longer you're sleep deprived, the less aware you are of the ill effects of being sleep deprived, and the less effect that adenosine has on your ability to fall asleep. So sleep is not an on or off phenomenon. There's actually different stages of sleep. And so sleep is really broken down into two main categories. There's REM and non-REM sleep. Within non-REM, there's a stage 1, which is a very shallow, easily transition between sleep and wake. Stage 2 is kind of the bulk of our sleep state. And stage 3 or N3 sleep is that deep, slow wave sleep, that coma-like sleep. For those of you who have children, they fall asleep in the car, you carry them in their room, you change their clothes, put them in bed, they don't wake up. That deep, deep sleep, that's so great. That sleep that if you wake up in the middle of the night, you're confused, that's most likely slow wave sleep. That's really where a lot of our recovery occurs, where we build muscles, we secrete growth hormone, we recover from injuries. And the other part is our REM sleep. That is we do dream in all stages of sleep, but in REM sleep, that's when you wake up and remember that, oh, that would be a cool TV show, that's a crazy dream. That's that state. That's mostly in the early morning hours. Slow wave sleep, N3 sleep, is mostly in the first few hours of night. The rest is filled up mostly by N2 sleep. But we have to have all of these different stages because they all have different restorative properties and different physiologic properties that we need to have in the right amounts throughout the course of a night for us to maintain all those homeostatic processes and all that recovery and all the benefits we get for sleep. So not only do we have to have a sufficient amount of sleep, but we have to have a sufficient quality of sleep. And that quality is largely related to, are we hitting all our different sleep cycles? And is anything waking us up throughout the night? So what is ultimately the role of sleep? Why do we sleep? It's not just because there's nothing good on TV or because it's dark out, but there has to be some physiologic need for sleep, because if you think about it, sleep is the most vulnerable state we can be in. We cannot protect ourselves during sleep. We're not productive during sleep. We can't find food or find shelter or keep ourselves protected during sleep. In fact, we even can't even maintain body temperature as well during sleep. So as animals, as living beings, why do we then sleep? Because it really goes against survival. Well, it's because of the restorative properties. There's multiple things. One is restoration, right? You have to have a period of rest where you regain your energy, but just sitting down and watching TV and not moving around really can be a state of restfulness. But there has to be something very unique to that being physiologically asleep, and it really is to maintain our homeostatic processes, to recover our bodies, to allow regrowth of injury, for immune function, and then also for memory consolidation. So that old adage, well rested, well tested, we really do consolidate and process new learning things during both REM and slow wave sleep. And then there's the glymphatic system, the more recently identified glymphatic system, much like the lymphatic system, where our body, well, the lymphatic system helps to cleanse our body of toxins. The glymphatic system helps cleanse our CNS, our brain, of toxins. So while we're awake, we accumulate different proteins and toxic metabolites. And then during slow wave sleep, actually the glymphatic system turns on and it flushes our CSF of these toxic metabolites. Now, unfortunately, what happens if we don't get a sufficient quality and quantity of sleep, we don't cleanse our lymphatic system appropriately. We have an accumulation of a thing called beta amyloid deposition, and that actually has been implicated with the pathogenesis of dementia. So I told you sleep is largely regulated by a circadian rhythm. So here we have a sleep-wake cycle. And so we can see that in most people, the period of greatest propensity for sleep is the early morning hours. And if we look at the right hand of the screen, so that brown, reddish brown line, where that's our propensity for wake, we see it naters between about 4 and 6 a.m. So the period where we have the greatest drive for sleep and the lowest drive for wakefulness is those early morning hours. Well, how many of you are already in the car driving to work at that time, right? So if you live in a big city with a lot of traffic, chances are you're in the car before 7 a.m. And unfortunately, that's when your body is most prone to being asleep. That's when you want to be asleep. And then it takes a little while for you to be awake. It's not just because you're getting more exposed to more light, or you're drinking more coffee, or you're getting more socially engaged, or you're more active, but just because your biologic rhythm, your circadian rhythms are kicking in. You're suppressing the secretion of melatonin because of light. And so when we get rid of melatonin, we have less drive for sleep. And so then you can see, we follow this line to the left side, we feel more and more and more awake until the mid-afternoon, where you see a little dip in our circadian rhythm, our wake propensity. Well, it has nothing to do with what you ate for lunch. This is a normal physiologic phenomenon where the mid-afternoon you have a lull. That's why some cultures have adopted a siesta. They go to sleep and they take a nap, a long nap in the afternoon, because physiologically we're supposed to be asleep then. The theory is it goes back to, you get up in the morning, you hunt and gather and find food. And then when the things, like lions and bears are out, they're napping in the afternoon, so you nap. And then you can see in the evening, our greatest propensity for wakefulness is actually right before we go to bed. And the theory is that's when you have to go find a safe place to sleep. Well, for a lot of people, they think they're rallying. No, it's really just normal physiology. One interesting thing about that mid-afternoon lull, so the concept of a smoke break or a coffee break came out during the American Industrial Revolution, when factory owners realized that the productivity of their workers was dipping in the afternoon. I don't think they understood a circadian rhythm, but they got the concept that people were getting sleepier in the mid-afternoon. So the idea was, well, give them a 15-minute break, pump them full of a bunch of stimulants, nicotine and caffeine, and they'll improve their productivity. Well, that's exactly it, right? So during that lull, when you're starting to get that sedating effect of the circadian rhythm, you counteract it with stimulant medications or stimulant substances like caffeine and nicotine, and it'll help you get through the day. You can see in the very top, the sleep drive, that's that adenosine they talked about. The longer you're awake, the more adenosine you accumulate, the greater your sleep drive. And if you can align those where your sleep drive, your adenosine peaks at the same time your circadian rhythm says it's time to go to bed, everything should be good. So after most people around 10 to 11 o'clock, they start rapidly losing their propensity for wakefulness, rapidly develop the propensity for sleep. And you can see that you rapidly clear that sleep drive, that adenosine accumulation with sleep. Now I'll go back, everybody's a little bit different, but most people, there is some individual variation, but most people are about, as I said, a 10 to 6 or 11 to 7 sleeper. So that brings us to what is sleepiness and what's excessive sleepiness. Well, sleepiness or somnolence is normal. The longer you're awake, the sleepier you get. That's a normal homeostatic process driven by circadian rhythm and external sleep drive that is actually a signal for us to go to bed. So that's normal. Being sleepy is normal. Excessive sleepiness, however, or hypersomnolence, is a pathologic version of sleepiness. That means sleep that impairs daytime function or causes sleep at inappropriate times. So how common is it? Unfortunately, about a third of Americans, I couldn't tell you the data in Canada, I'm guessing it's probably about the same, but a third of Americans are excessively sleepy. Not sleepy during the day, but sleepy during the day to the point where it's impairing normal daytime function. And that's a lot of people. So how much sleep do we get, and how much sleep do we need, and how much sleep do we actually get? Well, there's an individual variation. Some people say I do just fine on 6 hours a night. Some people say I need 9 to function. Honestly, there is a variation, but it's not as big of a variation as you would think. The vast majority of people, adults, need about 7.5 hours of sleep. The reason that, we've always touted you need 8 hours of sleep is it takes about 20 minutes for a normal person to fall asleep. You get, it's okay to get up once at night. And so overall, you're going to get about 7.5 hours of actual sleep time. If you do it within an 8-hour period, your sleep efficiency is pretty good. And that's what you need physiologically. You need a little more sleep when you're older, a little more sleep when you're younger, a little less sleep when you're older. If we look at large population-based health studies, it's about, 7 to 7.5 hours is what the human body really needs. Now, some people say, well, listen, it's fine. I get by just fine on 6 hours sleep. I only need 6 hours sleep. I only need 5 hours sleep. One rule of thumb is if the sleepier you are, the faster you fall asleep. The shorter your sleep latency is, the greater your sleep drive. So as I said, it should take people about 15 to 20 minutes to fall asleep. If you're falling asleep faster than that, you're probably sleep deprived. If you're falling asleep in under 10 minutes, that is one of the early signs of sleep deprivation. And if you're fall asleep routinely under 5 minutes, then you are clearly sleep deprived. That's an abnormal thing. Most people like to fall asleep very quickly. Who wants to lay in bed? It seems wasteful. Plus, some people can get very frustrated if they don't fall asleep quickly. Not being able to fall asleep actually is one of the most common causes of insomnia. Interestingly, insomnia begets more insomnia. So a lot of people try to push their bedtime till they're really, really sleepy so they can fall asleep quickly. Well, that's actually contributing to overall sleep debt. So how much sleep do we need? Again, looking at studies from the CDC, what the CDC guidance is, what the National Sleep Foundation says, one easy rule of thumb is 10 at 10. Meaning a 10-year-old needs 10 hours of sleep. Younger children need more sleep. As the older you get from 10, the less sleep you need. So newborns, obviously, they sleep all the time, at least about 18 hours of sleep. Toddlers are getting about 12 to 14 hours of sleep. Young school-age children, again, before 10 years old, are getting 10 to 11 hours of sleep. Teenagers need a little bit less. But a teenager needs about 9 hours of sleep. Young adults, about 8. Adults 7.5, older adults about 7. So unfortunately, that's not what we're getting. So over the last 30, 35 years, the average amount of sleep reported in North America has gone down by almost 2 hours per night. That's terrible. So in 1974, the average American attained 7.8 hours of sleep per night, so exactly what you're supposed to get. And now in 2021, or I guess the last time we did this was in 2019, the average American is getting 6.8 hours per night. So I've lost over an hour for most healthy people. Unfortunately, there are many populations that have gone down even less. And really the most concerning thing is that teenagers, the amount of sleep debt, the percentage of sleep debt among teenagers is atrocious. It's now, actually this is probably outdated. I didn't, the most recent reliable data says about 2/3 of teenagers are getting less than 7 hours of sleep per night. Other studies have shown over 3/4 of teenagers are getting less than 7 hours of sleep per night. Your teenagers need more sleep than you do. Unfortunately, in most households, the teenagers are getting less sleep than their parents. There are different professions that have historically less sleep than the average adult. So the military and at least the US military averages 6.2 hours of sleep when they're at home, and it's 5.7 hours of sleep when they're deployed. Most urban professionals, like many people on this call, are getting under 6 hours per night. And then in multiple studies of residents, especially surgical residents, are historically getting less than 6 hours per night. Work hour restrictions for residents did not lead to any measurable improvement in the amount of sleep that they get per night. So the bottom line is, the short story, the majority of us are sleep deprived. So, okay, so they're not getting enough sleep. Does it really matter? Well, it does matter. There's the next several slides, we're going to go over all the different reasons why not getting enough sleep is horrible for you. So what are the impacts of chronic sleep debt? Well, we're going to break it down by system. Neurologically, the sleepier you are, the more impaired you are. You have slower reaction times. It narrows your attention. In fact, in both children and adults, the diagnosis of ADD and ADHD should not be made in anybody who has insufficient sleep or a sleep disorder, because in numerous studies, the majority of both adults and children who were given a diagnosis of ADHD actually had untreated sleep disorders or insufficient sleep. So it's very common. You think that we do a lot of memory consolidation. I'll have some other slides on this as well, but without sufficient sleep, it's very common for people to, I'll call it brain fog and lack of attention. So, and that's just something that occurs very early in most people. So you tend to have diminished cognitive and executive functionings, decreased problem solving. So you don't tend to lose your ability for black and white or concrete thinking, yes and no, but the conceptual thinking, that gray zone, those things become impaired. So a lot of impaired moral reasoning and situational awareness and judgment, they're very common. And the other thing is if you're prone to seizures, sleep deprivation actually will lower your seizure thresholds. In fact, it's one of the ways that they induce seizures in people. They do sleep deprived EEGs to see if you're actually an epileptic. Behavioral health, a lot of irritability, depression, anxiety are much higher. We'll have some slides on that. Being sleep deprived increases your risk of developing PTSD after a physical or emotional trauma. Suicidality, being sleep deprived is actually an independent risk factor for suicidality, and having insomnia actually increases the risk for suicidality or completed suicide by 17-fold. People who are chronically sleep deprived have more missed work days and almost doubled the divorce rate. There's a chronic pain that goes along with this. I'll have a slide on that coming up. And there's an increased risk in both substance and alcohol abuse and impaired quality of life. Cardiovascularly, we'll have some slides on this as well. Just being chronically sleep deprived increases your risk for hypertension. In fact, it doubles your risk. If you have less than 6.5 hours sleep a night, you have more than 2-fold increased risk of developing hypertension over time. And being sleep deprived is an independent risk factor for both MI and stroke and overall cardiovascular death. And actually being sleep deprived has it increases your risk of cardiovascular endpoints more than diabetes, smoking, and obesity. 3 obviously known high risk factors for cardiovascular outcomes. Metabolic, we'll have some more slides on this as well. Sleep debt is independently associated with weight gain, obesity, insulin resistance, and diabetes. In fact, there's a linear correlation between that. The less sleep you get, the more weight you gain, and the more likely you are to become diabetic. Those people who get less than 6.5 hours of sleep per night will gain 3 to 5 pounds more than people who get more than 7.5 hours of sleep per night. So if you're fighting weight, get more sleep. It's unfortunately not calories in versus calories out. It's not just being tired and too tired to exercise. You actually increase cortisol and have an imbalance of leptin and ghrelin, so your body actually becomes more, so your body will preferentially make fat rather than use fat, more lipogenesis versus lipolysis. This is a slide I put in a lot of my talks, especially to young military people, sleep debt and what it does to testosterone. So the more sleep deprived you are, the lower your serum testosterones get. Well, that's really common among middle-aged or older guys who aren't getting sufficient quality or quantity of sleep. Somebody will check their testosterone, it's low, and tell them, hey, you need testosterone replacement. Well, that's not necessarily true. Maybe all they just need is sleep expansion. Well, this actually occurs in young people as well, and it occurs just as much in 20-year-olds as it does in 70-year-olds. Sleep restriction has a linear correlation with decreased serum testosterone levels. And those who are only getting 4 hours of sleep a night actually have 60% less testosterone compared to somebody who's getting a full night's sleep. Each hour of sleep loss, habitual sleep loss, lowers your serum testosterone by 15%. So let's break down some of the things we talked about a little further. Let's talk about the neurocognitive impact of sleep debt. This is a study that looked at some of the key sleep-wake regulating areas. The blue shows decreased metabolic expenditure. So basically, this is in an awake brain. You're supposed to be, these areas are compared to a normal person, we can see hypometabolic regions of the brain. Well, interestingly, where those are occurring are key sleep-wake regulating centers. The prefrontal cortexes that's our ADD area. That's what keeps us alert and vigilant. So chronic sleep debt actually will impair and ultimately lead to atrophy in that alertness center, that prefrontal cortex. Unfortunately, over that atrophy becomes permanent over time. So the longer you have sleep deprivation, the less likely it is for you to ever fully recover. And it's one of the reasons why ADD and ADHD, decreased vigilance, are so common with impaired sleep. The thalamus is really where the reticular activating system goes. That's what helps regulate wakefulness in us. And over time, you have impairment in those relays of those key wake parts of our brain. In this study, this is an older study, but I think it really does paint a very good picture of what happens to our ability for attention, to maintain alertness and attention as we get more and more sleep deprived. Well, in the blue, it's people who had, they were allowed to get 8 hours of sleep. And you can see that there really were no attention lapses. The yellow, those are people who were not allowed to get more than 6 hours of sleep. So when I tell you 4, 6, and 8 hours, it was they were woken up at 8 hours, they were woken up at 6, they were woken up at 4. So these people may have gotten less than 6, but so no more than 6 hours per night. And you can see just from 8 to 6 that there's a pretty big drop in the number of attention laps per hour. And the longer you are sleep deprived, the worse that gets. And so you have an accumulation of sleep debt over time. At 4 hours, you become impaired pretty quickly. And then you can see in that red box, that brown box, these are people who were completely sleep deprived. After just 2 days, they're falling asleep 12 times an hour. This is a similar study that looked at complex motor operations, your ability to do perform complex mental operations, and the longer you're awake, the greater the impairment from baseline. And in fact, after about 20 hours, you are functionally impaired. You lose about 25% of your baseline cognitive function. And after about 36 hours, you're under 75%. By 48 hours, you're about 50%. Now, obviously, most people don't stay awake for more than 48 hours, but impairment is considered anything under 80, in some studies under 75 and others. You can see that after 24 hours, you're there. So imagine if you, doing residents doing a 24-hour shift or 36-hour shift when I was there, or anytime you have to work through the night, you can see that you're impaired by the next morning. This is another really good study, I think. It took a bunch of people who were normal, so they not sleep deprived at all, and then they brought them in for a study. Some of the people they let stay in bed for 9 hours a night. Others, they had to get out of bed after 7 hours, 5 hours, 3 hours, and then again completely awake. And what they did was they looked at their ability to perform, how quickly their brain reacted, their reaction time to some time tasking. And you can see the people who got a sufficient amount of sleep had no changes every day to day to day. They stayed completely at 100% of their baseline. Those who were just woken up after 7 hours, now most people think 7 hours is a sufficient amount of sleep. You can see that even by day 2, they were starting to have some measurable impairment. And by the end of the week, they got a little bit worse each day, where they were about 90% from their baseline at the end of the week. And that's just with 1 hour of sleep impairment. Wake them up at 5 hours, you can see that they have a pretty rapid drop off. They do taper. So at some point, your body's gonna adapt to this. Those who were really severely sleep deprived, only 3 hours, they continued to get worse and worse and worse. And obviously those who were had complete sleep deprivation couldn't make it past the second day. Now, the interesting part about that, so, okay, that makes sense. The more sleep deprivation you accumulate, the more impairment you're gonna have. But what I think is the most important part of this study, and this has been replicated 2 other times, they found the same thing, is afterwards, they let these people get as much sleep as they wanted for 3 days. They could stay in bed, they could sleep as much as they possibly wanted, and they repeated those time testing. And you can see that even after 3 days of recovery sleep, nobody got back to baseline. Nobody got back to baseline. They've done a similar study, and they went out to 3 months. They kept people sleep deprived for 6 months, and then they let them get completely recovered and get a sufficient amount of sleep for 3 months, and people still never came back to baseline. So the question is, do you ever fully recover from sleep debt? At least the best we can tell you is no, you do not. So obviously avoiding sleep debt is the most important thing, but it's just like smoking. What is the best time to stop smoking? Today. Tomorrow is not too late, right? Same with sleep debt. Try to avoid accumulating sleep debt, but if you are chronically sleep deprived, you got to fix this now. The sooner you fix it, the more recovery you'll have, with the understanding that you're probably never going to completely recover from your sleep debt. So there's been a lot of studies looking at sleep debt and driving safety. The bottom line is the longer you're awake, the more impaired you are. After 17 hours, you are impaired. After 21 hours, you have the amount of impairments that's equal to alcohol impairment, at least in the US, that's the legal limit. It's 0.08 in the US. I don't know what it is in Canada, probably 0.5. I think you're big drinkers up there, right? But I was actually on the NTSB for a while. So the National Transportation Safety Board put a sleep doc on all of its teams. Why? Because we realized that most transportation accidents had some degree of sleepiness in there. In fact, in the US of commercial accidents or accidents involving commercial vehicles, up to 40% were fatigue related, and the duration of sleep in the preceding 24 hours of that driver was the most important identifiable factor in all Department of Transportation accidents. So this impact of drowsy driving has been the subject of a lot of research over the last several years. Some things that I've looked at in the US, they estimate that every month, 56 million drivers are driving drowsy. I'll be honest with you, I think it's much higher than that. 8 million drivers, at least in one large study, 8 million people admitted to falling asleep while driving monthly. And half of those actually drifted into another lane, and 10%, this is actually from real data, 10% of people fell asleep and ran off the road. About 1 million motor vehicle crashes every year involve somebody falling asleep at the wheel. Unfortunately, 1/3 of fatal crashes involve a truck driver falling asleep at the wheel. You can see the rest there. It's a big deal. It's a very big deal. In fact, drowsy driving is more likely to lead to motor vehicle crashes than alcohol. You can see the other things, like all these things that we talk about, these distracted drivers, someone putting on makeup in the car, shaving, eating, reading, texting, doing all these, listening to the radio, looking for a radio station. Those are all important. And I'm not downplaying that those also have a role in accidents, but they are nowhere near as important as drowsy driving. You can see this, right? Somebody putting on makeup in the car is about 1/15 as dangerous as driving sleepy. So sleep debt and dementia is something that I actually have done some research on. I think it's really important. And the more we learn about the impact of sleep and dementia, I think the better. The prevalence of all different types of dementias is markedly increasing. And interestingly, at the same time, as I pointed out before, the average amount of sleep everybody gets has gone down and down every decade for the last 40 years. Well, are those true and unrelated? I don't think so. I think they are absolutely related. Not only is our sleep quantity going down, so is our quality. There's more and more, we have more stress, there's more insomnia, there's a lot more sleep apnea than there used to be. There's more medication use that leads to sleep fragmentation. And we know that people with dementia have poor sleep. Often dementia will lead to an inversion of sleep-wake cycle. There's more insomnia at night, more daytime sleepiness. That inversion of sleep-wake cycle can just propagate more delirium and more dementia, decreased cognitive impairment. And we know that people with dementia have a high rate of of sleep issues. But it's very clear that long-term sleep debt is an independent risk factor for the future development of cognitive decline and dementia. As I mentioned before, there's a lot now that we understand more about the role of the glymphatic system in clearing those beta amyloid proteins and tau proteins. And so if you don't cleanse it through the glymphatic system, and that's only active during slow wave sleep, then you will have more cellular damage and increase the risk of Alzheimer's disease. And that actually is what we see in people with Alzheimer's, those plaques that are formed from those proteins that are accumulated, the beta amyloid proteins and plaques and tau proteins that are accumulated. Now that we realize it's due to longstanding sleep debt. Sleep debt is not only from not being asleep long enough, but if you have things like sleep apnea or insomnia, even if you're in bed for 9 hours, but you're not getting consistent, continuous sleep, that's, again, you're going to accumulate sleep debt. So it's not only the quality, but the quantity, but also the quality of sleep that has been associated with the development of dementias. So sleep, pain, and behavioral health all go hand in hand. We know that there's a bidirectional, interdependent relationships between all three of these. So we know that people with depression have a higher pain, higher reported pain, lower pain thresholds. We know that people with chronic pain conversely have more depression and anxiety. So those seem to go hand in hand, and people understand that very well. Chronic pain and behavioral health issues, a clear bidirectional relationship. Well, we know that sleep quality and chronic pain have also a similar bidirectional relationship. The people who have chronic sleep debt have lower pain thresholds and a greater pain response, and people with chronic pain have lower sleep quality and more insomnia, more daytime sleepiness. In fact, your amount of sleep that you obtain is predictive of how much pain you're going to have the next day and how much pain medications you will use. Conversely, the amount of pain you have during the day will predict how well your sleep quality will be at night. Well, that makes sense. If you're in pain, it's hard to fall asleep. So there's a clear relationship between there. And then again, to finish that whole thing out, the relationship between sleep and behavioral health. We know that if we look at DSM-5 criteria, most behavioral health diagnoses will have a sleep component to it. Well, that makes sense. But what we've learned more and more is that having a pre-existing sleep condition or sleep debt, insufficient amount of sleep, is an independent risk factor for the development of anxiety, depression, PTSD, and, as I mentioned, suicidality. So this perfect triangle, how they all interplay with each other. So the less sleep you have, the more likely you are to have chronic pain and a behavioral health condition. So just to kind of go over this again, chronic pain and sleep, as I said, it's a reciprocal relationship. The worse your pain is, the worse your sleep quality will be. The worse your sleep quality is, the more your pain will be. In fact, almost half of people who are chronic with chronic sleep debt or short sleepers will report chronic pain. Interestingly, of people who are getting more than 7.5 hours per night, only 8% of them report chronic pain versus 42% of people who are sleep deprived. And again, the majority of people with chronic pain will report poor sleep or sleep disturbances. If you have people with chronic pain who report poor sleep, actually have worse quality of life, increased healthcare utilization, and a greater use of pain medications than people with chronic pain who don't report sleep debt or don't have sleep complaints. And as I mentioned, sleep itself is an independent risk factor for development of psychiatric conditions. Not only are sleep complaints common in people with psychiatric conditions, as I mentioned, it actually has become known independent risk factor. So insomnia and sleep apnea have been well studied, and also insufficient sleep. If you have insomnia, you have almost a 3-fold increased risk for developing a behavioral health diagnosis within the ensuing 3 to 5 years. And if you have sleep apnea, untreated sleep apnea, you're almost doubled your risk for developing a behavioral health disorder, usually anxiety and depression. And those people with chronic sleep issues, either a sleep diagnosis or sleep debt, it does portend worse outcomes. You have a diminished response to therapy, a greater risk for relapse, more hospitalizations, and as I mentioned over and over again, more suicidality. So let's talk about sleep debt and metabolic health. So sleep is very important. As I mentioned, sleep is there to regulate our homeostatic processes. We secrete growth hormone, we build muscle, we recover from injuries, and we regulate our leptin and ghrelin levels. So those who don't have a sufficient amount of sleep actually increase their cortisol. So it's a stress hormone that goes up. That increased cortisol actually leads to insulin resistance and weight gain. We also have an imbalance in leptin and ghrelin. Leptin and ghrelin regulate hunger and satiety. So if you've ever been awake a little longer, you're a little sleep deprived, what you'll notice if you pay attention to it, you'll actually have carbohydrate cravings. So the body understands this. You need that quick energy fix, right? So it's very common for people to reach for that candy bar or some quick carb when they are sleep deprived. Well, over time, you actually have imbalance in leptin and ghrelin, where your body will lose its ability to regulate hunger and satiety. So you'll increase hunger without feeling full as quickly. Overall, that leads to decreased energy, metabolic expenditure. So your body essentially becomes more efficient at storing fat than utilizing fat. Well, it makes sense, right? So we're humans, we're physical, we're animals, we're all about survival on an intact level. So people who are chronic sleep debt, the body starts going into survival mode. And this conservation. If you think about a bear, before they hibernate for the winter, they put on a whole lot of fat, right? Well, the same thing goes with people. If you're chronically sleep deprived, you're going to start putting on more and more fat for survival reasons. In the Wisconsin sleep cohort, they followed people for a long period of time. They actually found that those with normal sleep duration, so over those with 7.7 hours of sleep per night, actually predicted the lowest BMI. And conversely, those who were habitually getting less than 6 hours per night was independently associated with obesity and the development of diabetes. So in the Nurse Heart Health Study, they followed healthy nurses over a 40-year period. One of the things they did was they measured weight and BMI each year, and you can see the correlation between, this is on the right hand of the screen, the correlation between chronic sleep debt, or the amount of sleep that you get per night, and what your weight is. I mentioned before, those who get less than 6.5 hours a night will gain an additional 3 to 5 pounds more than people who get a sufficient amount of sleep. And we see very similar statistics with the Nurse Heart Health Study. On the left, we can see a 13-year prospective study of 5,000 patients. And again, we see very similar thing. The more sleep you get, the lower your BMI is. The less sleep you get, the higher your BMI is. So let's talk about sleep and the immune response. So actually being sleep deprived is a relative immunocompromised state. So you have a diminished immune response. So it's one of the many things that occur during sleep is we not only do you have altered glucose metabolism, and being chronically sleep deprived is a pro-inflammatory state. And those two things together make us more prone to illness. But if we get an illness, being sleep deprived also diminishes our response to that illness. A lot of that has to do with the circadian rhythmicity of our immune system. So like everything else in our body, sleep, things recover, our body recovers during sleep. If you're not getting a sufficient quality or quantity of sleep, even our immune system has to rest at night and recover. So what we do see is, again, a diminished immune response. There's actually even a diminished response to vaccinations. Those who are chronically sleep deprived are going to have a less robust immune response to vaccines. And I've found this study very interesting. If you habitually get less than 7 hours of sleep per night, you are 3 times more likely to get a cold than someone who's getting more than 7 hours of sleep per night. As I mentioned, chronic sleep debt decreases your resistance to infection. Even your white blood cell count will go up. The less you sleep, the higher your white blood cell count will be at baseline. But it changes the percentage of what white blood cells there are. And again, that has something to do with that innate ability to fight off infections or prevent infections. So not only do you have less first line defense against preventing infection, but then you have a decreased immune response to fight infection that you do get. You have decreased phagocytosis, phagocytic properties of neutrophils, and you have a decreased ability to clear pathogens. And again, those first line things, you have dysregulation of natural killer cells, and then your pro-inflammatory cytokines. So if you get infected, your body mounts an inflammatory reaction to fight those things off. Unfortunately, if you're sleep deprived, you're already in a pro-inflammatory state. So then it's harder for you to mount an additional inflammatory cascade on top of that. Let's talk about sleep and cardiovascular health. If you get in the theme here that sleep debt really sucks and causes a lot of problems. Let's talk about cardiovascular health. Well, there's a clear and undeniable link between sleep debt and cardiovascular disease and adverse cardiovascular events. So as I mentioned, sleep is a pro-inflammatory state, and the pro-inflammatory state leads to endothelial dysfunction, formation of lipid plaques in our body, and then unfortunately, disruption of those lipid plaques. So we have an increased autonomic tone, meaning that our blood vessels become heightened. We increase a greater catecholamine surge goes on at all times. Over time, that autonomic tone just remains elevated. It leads to a lot of arterial thrombotic dysfunction. So you're more prone to making and dissolving clot. You get endothelial dysfunction, so our blood vessels become stiffer and less compliant. We have impaired fibrinolysis. So again, back to that, we're more prone at making clot than dissolving clot. As I mentioned, it causes insulin resistance, diabetes, and weight gain, which are independent risk factors for developing cardiovascular disease. All this together means that all those chronic effects of not getting a sufficient amount of sleep ultimately will lead to development of cardiovascular disease and increased risk of cardiovascular events. So exactly how much of a risk is there? Well, so in this meta-analysis that looked at 15 decent studies exploring the correlation between cardiovascular outcomes and sleep duration, that went anywhere from 7 to 25 years. It looked at over almost 500,000 people across 8 countries. And they broke it down into 3 categories: very short sleepers, normal sleepers, and long sleepers. What you can see is your risk of developing or dying from coronary artery disease was worse in both short and long sleepers. So the question is, why would more sleep be bad? Well, the idea is, why do you need so much sleep? What is wrong with your sleep quality that you need so much sleep? So really the key is, and there's that U-shaped curve, it's been shown in a lot of different studies, short sleepers and long sleepers both do very poor compared to normal sleepers. And we can see here an almost 50% increase in dying from cardiovascular disease or coronary artery disease if you're getting insufficient amount of sleep. And then same goes true for stroke, where there's about a 13% increased risk in short sleepers and a 65% increased risk in long sleepers of dying of a stroke. Looking at sleep mortality. So the three biggest studies, population-based studies that looked at sleep duration and mortality, were not sleep studies at all, but these are just population health studies. So the nurse heart health study that I mentioned earlier, again, 83,000 healthy nurses followed over 40 years. The Japanese sleep cohort, or a collaborative cohort, is 100,000 people followed about 20 years. And then the NHANES registry is over 1 million subjects. So there's a lot of data that has looked at this, and this is normal population-based things. Again, that truncated sleep associated with increase in all-cause mortality. There's a U-shaped curve, meaning that both short and long sleepers, if you get less than 6, or greater than 8 hours a night, both of those increase your risk for mortality. Ideally, the people who live the longest, about 7 to 8 hours of sleep per night. What about sleep and athletic performance? Well, just like mental performance, athletic performance was decreased during sleep. I mentioned that slow wave sleep is where we secrete growth hormone, we build muscle, and in sleep, we recover from injury, we get stronger, and we rest and recuperate our body. So both acute and chronic sleep deprivation impairs physical performance. You have a decreased endurance, you have decreased assessments of strength, you have decreased accuracy. So whether you're shooting basketballs or tennis serves, studies have shown that people with insufficient amount of sleep do not do as well. You have a longer recovery time in injury, greater risk of injury, and then less overall muscle mass. Sleep debt and injury is something that I've studied a lot with the US military. So those who are sleep deprived are more likely to become injured and have a longer time to recover from those injuries. And so in a couple of studies here, you see that those who get less than 8 hours per night are about 70%, have a 70% increased risk in developing an injury. And again, as I mentioned, you also have a prolonged recovery time. Now, you think that if sleep deprivation is bad, sleep expansion must be good. In fact, it is. So some studies that have looked at the amount of sleep attained of professional athletes is actually quite amazing. So those like the US Olympic team, on average, what they tell the US Olympians is they should be getting 10 to 11 hours of sleep during high intense workouts. The NBA also has that a recommendation that during the season, when they're working out and playing games, they try to get at least 9 to 10 hours of sleep per night, because that sleep expansion improves outcomes. There was a study done at Stanford University where they tried to expand sleep in their college athletes. So again, these are young adults, and I told you before, young adults need at least 9 hours of sleep, and if they are an elite athlete, they need probably about 10 hours of sleep a night. So they, in the study, at baseline, they were getting 6.7 hours of sleep per night. So that's sleep deprivation for adult, that's absolutely sleep deprivation for a young adult and insufficient for an athlete. And they expanded them. The goal was to get them to 10 hours per night. And that would have been ideal. But they can only get these people to 8.5 hours per night because, they're college students and they're only going to get so much sleep. But at least they got almost 2 hours extra sleep per night. What they found was the basketball players actually were able to run faster and they improved their shooting accuracy. Tennis players, same thing, run faster and improve their shot accuracy. So it does work. You don't have to get 10 hours per night, but that would be ideal if you're a young athlete. And again, what we do with the US, I do a lot of work with US Special Operations Command on sleep and human performance. And again, the more you sleep, if nothing, forget about physical and cognitive performance, you are less likely to get injured and you will recover much faster compared to those who are sleep deprived. So let's talk a minute about, we're almost done, about over-the-counter wake promoting substances. Well, they are not as effective as you think. So you can say, well, I'm sleep deprived, but I'll drink some coffee, go to Tim Hortons and pick up some coffee on the way to work, or I can take a 5-hour energy or Monster or Red Bull, and that'll do just fine. Well, a lot of those will just mask the sedating effects of adenosine. They don't actually promote normal wakefulness, and they can impair your ability to fall asleep that next night or fragment your sleep. So remember, I told you it's not just sleep on and off, it's your stages of sleep. So all these wake promoting substances, not only does it make it harder to fall asleep, so you subsequently have less total sleep, but it will fragment your sleep, more wake after sleep onset, disrupt your normal sleep architecture, so less slow wave sleep, so less of that recovery sleep. And then the next day you have the same amount of sleep debt plus a bad night's sleep. So a lot of these actually will propagate more and more sleepiness. So wake promoting substances have actually been shown to cause more sleepiness than wakefulness over the course of time. So the idea is not to rely on something to keep you awake, but rather to do what's right and get enough sleep. So with that, I'm going to stop and open it up to any questions that you may have.